Hi guys, welcome back to HAG Studios. Today we're doing a doctor's visit and we're with Dr. Adrian Mitchell. He's an OBGYN and we're going to talk about everything or almost everything to do with women's health.
Thanks for having me. It's nice. Welcome. So, I hear you have some burning questions from your audience. What can I help with today?
Okay, first I have a burning question from myself. Your mom is one of Jamaica's well-known OBGYN, Dr. Charmaine Mitchell. What is it like working with her? You're now sharing office, you're doing operations together. As a mentor,
well, it's interesting. I think you knowing me from tot and high. It's interesting. I think a couple of terms would say it's a great mentorship.
Yes,
it's intimidating at times.
It is.
And but at the end of the day, you're sharpened to an essence of being around one of the best in the field locally.
Yes.
And I think I enjoy it a lot. So the short version is that I'm humbled. It's a gift from God. And I don't take it lightly, but I don't work with her. I work for the boss, so I work for her. You know,
Okay.
So I think that is an interesting dynamic.
Yes.
I think it may move from time to being mother to son to more being mentor to mentee.
Okay.
And it's an interesting dance. It's not something that you necessarily have a clear established rules. There are times when she would teach me things, and times I said, "Well, Mom, this is where we should be heading."
Okay.
So it has been interesting, very interesting.
What do you call her when you're at work?
I would say, politely. I don't call her Dr. Charmaine. She's mom. So I don't care about wardrobes or anything. And I think that happened through med school coming up. And
because she taught you in med school as well.
Yeah, I'll call her mom. I'd be corrected by her peers, and friends would come and talk to me, and I'd look them straight in the face and say, I don't know her as Dr. Charmaine, I know her as mom.
Yeah.
So if I call her Dr. Charmaine, I think it goes to the point that something is going on that we need to stop. But I call her mom. Yeah,
okay.
I call her mom.
That's interesting.
Yeah.
We're gonna start with, let's start with maybe the periods.
Okay.
Is there any change now in terms of age where girls are starting to menstruate earlier, or is there any change over the years?
Wow. Change is such an important term. I think change is a constant in life. And people may argue that with the Western diet, you may see girls enter menarche a little better. So you find that there is a tie in between girls putting on weight in the ages of 8 to 12. And when you put on too much weight, you find that the period comes on.
Oh, really?
A little earlier. But I would say it hasn't changed from back in the day. I mean, there's no grand thing to say, girls are experiencing their period a lot earlier than normal. No. But you do have girls starting at 8, which is fine, it's healthy. But you're not seeing them at 6.
Early is a bit, 8 is a bit early though.
Some girls start
it's almost frightening.
It is, and it's important that a great mother-daughter relationship is in play, and a little bit of coaching. But gynecological health begins around that time, and arguably so. A lot of girls at 8, 9, they're very frightened, and I guess
that's what I was thinking.
If they're not kind of coached through it by a great coach, a mom, a aunt.
But what if they don't have a mom to coach them?
Wow, I think I've met a very interesting case where I saw a dad, and I was very humbled by him. He took her to the doctor. He's like, hey, this is going on. But you find that you do have mother figures in some of their lives. So a grandmother, an aunt, will butt in. But they tend to show up to us as a doctor when there is a lot of pain or the periods are a bit irregular or too long. So we don't tend to get the birds and the bees talk about, how do you help me to describe what's going on with my daughter? So we find that still, here locally, that's still being done pretty well. Yeah.
Okay.
Yeah.
So tell me, when a girl starts her period so early, does it mean that she goes into menopause earlier?
Okay, very excellent question. And the answer is no. Regardless of the age you start, it doesn't predict very well when you go into menopause. But you can have a strong family history of having early menopause, and that now goes into the gray area of what has happened in your family to a lot of women. You do have women that enter menopause at 35, some who enter at 40, and that's considered early because the average age in Jamaica is between 51, 53. And it's important to have that discussion with your doctor. And that's why I say as soon as the menstrual cycle starts, it's good to have young ladies come in and speak to the doctor so these things can be documented. Some parents say, oh my God, it's too young to put a girl in front of an OBGYN at that young age. And I'd like to dispel that myth. It's important for her because she gets used to her doctor, and it's good for the continuum throughout her whole fertility life. And I think that now goes into the big question of the transition. You know, we have to remember that young girls who start their period, they're not necessarily fertile at the first couple of periods because you don't necessarily ovulate for each cycle.
Really?
As you mature
That's
and
new
grow,
to me.
as you mature and grow, your body will get more acclimatized to the hormones that it makes and now is able to kind of learn how to ovulate. So it's like riding a bicycle. You'll never be able to ride it without a training wheels. But after a while, your body gets used to it and say, oh my God, I can hatch an egg. So not every cycle a girl has in her first couple of periods will produce an egg.
Oh, so what is it producing?
Nothing.
Nothing?
Just the hormones, and actually it's not enough to necessarily cause the production of the eggs to mature.
And that usually takes a few months before she starts to ovulate.
It's a gray zone.
Years?
It's a gray zone. I can't say that necessarily as a formula, but I can say definitely if you have 12 periods for the year in a young girl, not every cycle should produce an egg in her first couple of periods.
Okay.
Especially in the first couple of years of her menstrual life. But as you know, edges know necessarily into her third, fourth, fifth year of her menstrual cycle, you find that she produces more eggs as time continues.
Okay.
Yeah.
All right, that leads us to menopause and even before menopause. So many women are concerned about when they should have children and if their time is running out, that biological clock. What would you say is a time where that becomes, where the clock so stop ticking?
Wow. Well, I would say that it's a gray zone again too, because that clock can stop ticking, as I mentioned before, in the 30s. So you want to pay attention to the patient who's speaking about skip cycles. You want to pay attention to the patient who's complaining about perimenopausal symptoms. So for instance, a patient who's complaining about hot flashes, irritability, mood swings, and her cycle going missing every now and then. Because that can clue into the fact that, oh my God, this patient may actually have symptoms of early menopause and she may be going into it. But it's a dynamic type of topic because individualized to the patient.
Yes.
So you find that saying that it may happen because you're having these symptoms may not, because you do have other diagnoses that we may entertain as physicians, such as polycystic ovarian syndrome, which can actually be the cause of some of these symptoms. Not necessarily the ones with the hot flashes, but other things can cause it.
Okay.
So overall, I'd say if you're going to consider when is menopause occurring, and officially you'd say as a doctor is that when a woman really doesn't see a cycle for a year, 12 months. But you know, having a skip cycle or a couple of skip cycles, you may want to go to your doctor and figure it out if something is going on.
Can you talk a little bit about the rhythm method of contraceptive and how a woman knows when that will work or how to work that?
Well, I would start off by saying the rhythm method is an interesting tango between two partners, and why I say that is that your counterpart has to be with you in this dance, because if you break the rules of it, you will get a little one, and I don't mind. I'd love to deliver them, you know. But the rhythm method speaks to a woman knowing her cycle and her fertility window, and using the ability of knowing that to avoid pregnancy.
Yeah.
Now, keep in mind that, you know, officially it's going to be the lowest form of contraceptive on the market. It does fail because if you do break the window periods, you're going to get pregnant. And also keep in mind that your body is not necessarily a written book that follows all the rules all the time. Your period may fluctuate. Your ovulatory window will fluctuate based on stresses that you go through in life and things that may happen. So you have various things that can interfere with the rhythm method. But what it essentially does is that there are safe zones that are considered right before ovulation and right after ovulation, in which a woman can engage in unprotected sex with her partner and not have to necessarily worry about pregnancy. And yeah, I have a couple of patients who have mastered it with their husbands, and they're really, really good at it. And as I said, it's an interesting dance because the men know that during this time, and they actually have it on their phones to where they say, okay, I'm not troubling her during this time, I'm serious. And they will know, if, okay, fine, our period's about to come, we can have this amount of fun, or if we're going to have sex during that time, we're going to take that extra precaution and actually use protection. Now, it goes into the next dynamic tango, as I said, where what happens if you do engage in sex during this time and actually, you know, you're now resorting to the fact you don't have a condom, it's with your partner, you guys are used to not using condoms. So a lot of people go for the withdrawal method. Now, doing that with the rhythm method does increase your chance of naturally conceiving because things can happen. You do have pre-cum, you do have a little that can escape, and that can produce a nice little baby. So it's that tango now, it goes back to body language, conversation. It's important for each partner to know when each other is climaxing, for the woman to know, okay, fine, he's getting too excited, I'm in that window, he needs to pull out and he's not doing it. So that, no, as I said, if it's not, if communication in the bedroom is not a big topic or not done very well, you know, we can have a little one join us very soon. So it's important to have that dynamic conversation, and I use the word dynamic because it's different. You know, everybody deals with this topic a little different in the bedroom. And how do you approach engaging in rhythm method? But I will tell you, if it fails, I'm glad to have you.
Okay. Is it that is it best for people who have regular periods then?
Well, that term "best for people with regular periods," I would edge away from it, but the effectiveness of it works better for somebody who has a better time cycle. Yeah. But you know, I wouldn't say that everybody should be exclusive. I think that, you know, it's important that we speak about some of the modern day technology, which is like ovulation test kits. So I have patients who actually take ovulation test kits to know, okay, fine, there's an egg around and I can't go and have fun. Oh yeah, you piano stick. Oh yeah. I won't call pharmacy names, but they're available in most
pharmacies.
Big brand pharmacies here. You buy it, go to the pharmacy, say you want the ovulation test kit, you pee on it, you see 2 lines, you know, no go. So a lot of patients do use that, and they're pretty good. They work. So that's a bit of modern technology for you, and that wasn't available back in the day, but now, young girls.
I've never heard about it.
So it's a new thing. Young girls, instead of I've had a couple of young girls who are in the office and they're pretty in vogue, and they say that instead of they have their partner, what they do is that to ensure that they're not going to get pregnant, they pee on the stick. Once they see 2 lines, they tell them, hey, no go. But if they go to the line, it's all fun for them. So yeah, that's something new that patients are doing. Yeah.
That's interesting. Okay, so what advice do you give to persons who are delaying starting their family, for whatever reason?
Okay.
I'm sure there are lots of new innovative ways of doing that.
Okay, well, the first bit of advice that I'll tell all the women is don't get despaired and don't rush the process.
Yeah.
You'll meet somebody, and you know, the idea is that, you know, as you go through this process of meeting somebody or going through the gray area of saying, oh my God, my fertility window is getting narrow, you should speak to your doctor, because we do offer egg freezing. We do have that facility available in Jamaica. Really? It's affordable. It's not bad.
Where is that done? At the University
Hospital?
Of the West Indies?
Yeah, the reproductive unit. They have invested quite a bit in.
Do you have a lot of persons taking it up?
I would say a lot is a very sketchy term, but I would say that overall you do have women who have become very interested in it, and a lot of that owes to marketing and also you know, wide knowledge. A lot of people who can afford it tend to do it abroad because they don't know that it can be done locally. So we do have patients now slowly, as the modern woman starts exploring, you know, what else is there, you know, start picking up locally. Yeah. But we do have patients who come in for that. We do have patients who, you know, go to the other extreme where they, for instance, want surrogacy or sperm donation, which can also be done locally in Jamaica.
You're getting sperm donations here as well.
Yes, sperm flown in. It's not given locally. we don't take from the local sperm bank for several reasons, more than one. Yeah. So
what's
sperm is
one of those reasons?
well,
Might be related.
yeah, well that too, and then we don't want the issue where a gentleman runs into his kid, on the road. I mean, that's real. That can happen. So we do have that available locally, and I reassure a lot of women that this magic number of 35 has slowly gone to 40 because with technology, a lot more modern science being available, you find that the chances of getting naturally pregnant with 35 and 40, yes, is reduced compared to your 30s or early 30s and early 20s, but you find that people can still naturally conceive. Is when you hit that window of 40 to 45, your chances of natural conception is going to be a lot less. And I guess patients are worried about, oh my God, is my baby going to be normal or not? And I agree that the eggs do age and that increases your chance. But we do have testing and also enough information now available that we can get you the information so you can make a great decision. And it's available here locally. A lot of the things can be done locally, and I would edge to say that some of the things that you can get offered in first world countries we can have done here, especially in the Caribbean.
Okay.
Yeah. So I mean, I do tell the modern woman who's after a career, still go for your dreams, still have it in your time. And more important, I tell all of my patients, find somebody that you do love. It goes a far way when you have a child with somebody you do love. And I can speak with a bit of authority sitting here as a physician to a lot of my female patients. And whether the relationship lasts forever or not, just keep in mind that child and that partner will be a part of your life forever. And a lot of them say that it does matter that I do love that person. And it goes a lot in how that child is raised also. So I do reassure a lot of the modern women that it's okay to go for your dreams, and it's okay to necessarily achieve what you want and how you want to make yourself happy, but try not to fall into the ideation of what society says, you should be married by your early 30s or late 20s, and you should have had your big house and your picket fence. Don't rush into a reality that can cause a lifetime of necessarily picking up the pieces.
Yes.
And I find that a lot of my patients who I would want to classify who have waited, they'll say night and day, hey, I'm glad I did.
Yeah.
And I'm not saying those who didn't wait, are any less. I mean, a lot of my patients who, and it goes to the big topic, there's no perfect time having a child. And I reassure a lot of my patients here in this office, there's no perfect time having a child. And you think that waiting a little longer will make you more ready. No. And having it a little earlier would make you be able to run behind each other. No. I think the big important thing and the message I leave a lot of my patients with, do it when you, more importantly, feel that this is right for you. This is something that you have decided you want to move forward with, and that's going to go a far way. It's going to go a far way. And I can tell you that, a lot of them at the end of the day will tell you that's true. But there's no perfect time to have a child.
Okay. What causes fibroids?
Wow. I mean, I'd have to sit on the political side and say, in our population, genetics play a massive role, and our ethnicity plays a massive role. So you find that black women tend to be at risk for getting fibroids, and genetically, we find that there is some risk factors associated with certain gene pools. But, it goes into the other big topic, if you eat chicken, white meat, some people would say foul pill, birth control pills, I don't know, I still smile when I get those, but those don't necessarily increase your risk. They do promote the growth though. Hormonally fed meat does promote the growth of them. But not necessarily because you eat chicken, you're going to get fibroids. I tell my patients, no, that's not necessarily the case. And when you dig a little bit more in the history, you do find out a lot of patients who do have fibroids, there's a family history of it. And that's one of the biggest things. If you do have a strong family history of fibroids, there's a high chance you should be surveyed and you will get fibroids. And some of the most common thing you find with patients with fibroid is that they have irregular periods, or they have bleeding in between periods, or sometimes just painful periods. So that goes into the dynamic. I love the word dynamic because each woman I consider different. Conversation between your gynecologist, what's going on with your cycle. Because some patients actually have normal cycles and the fibroids are there and they're massive.
Really?
So
should they always be removed?
Wow, big question. Not necessarily. If they're asymptomatic, they're not having any symptoms of anemia, pain, heavy bleeding, you'd want to probably be conservative or respect the patient's wishes if they don't want surgery. But it goes into the next big topic. How big has it to be to consider removal? A lot of doctors work with the gray area of 4 centimeters. Once you start edging over 4 centimeters, doctor will say, boy, it's going to continue growing, it's going to get bigger.
Are they likely to become cancerous or?
Very, very low potential for cancer.
Low potential.
You do have some, though, unfortunately, that can become cancerous. And it's hard to predict by just examining and talking to a patient. It's normally something that has to be tested. And a lot of the doctors, when you do a myomectomy, which is removal of fibroids from your uterus, they will send it off for analysis by a pathologist who will look, cut it up in small pieces, look under the microscope and see if it's cancerous or not. So it's important after you do a surgery to ask your doctor what were the results and if there's a potential for cancer. But if you ask me on a grand scale of, if you do 100 surgeries and how many of them are cancerous, 1 in 100, 1 in 1,000.
It's not very common.
It's not very common. It's not very common, but it can happen.
Other common cancers that women have?
Oh, I love this topic. There is one that I am, for my career in ONG, I think I'm very interested in, and that's going to be cervical cancer. And the reason why I'm very interested in cervical cancer is going to be very common in our population, and lower than breast. Definitely, I think is number 3 for us in terms of being prevalent.
Oh, so what would be number 2?
Number 2, I think.
So breast is number 1?
Yeah, I think
really?
Number 2 is ovarian, I think. Yeah.
Okay.
Yeah.
Okay.
So cervical cancer is going to be the one that I'll tell a lot of patients that is preventable. Breast, unfortunately, and ovarian, you can prevent it. So, very few opportunities you can prevent it. But cervical is preventable, and a lot of that is owed to a vaccination that has been given to us for more than 15 years. And that actually prevents the virus from actually causing the changes. And that's the HPV, the human papilloma virus vaccine. You get it in your arm. It's 3 injections.
Is it being taken up?
If I know, yeah.
No, more people are taking.
When it just came out, just like the COVID vaccine, it was
you have
it was hard for people to
reservations.
take it. Yeah, but it's been around for more than 10 years, more than a decade. People are realizing it doesn't affect fertility, it doesn't change much, and it actually works.
And it works.
So you find that now people are jumping on the train a little later when the price is through the roof. And with the change in the dollar and everything, and they're like, oh my God, I need this vaccine. But it's something that I tell people, get the vaccine, it prevents. And I encourage a lot of my patients to vaccinate their daughters and also their sons, because the idea is to reduce the spread.
Oh, really? It's for sons as well?
Oh, yeah. Actually, men carry it on their penises. Yes. Okay. So, unfortunately, you want to not only vaccinate women, you want to also vaccinate men. Because if you vaccinate men, it reduces the chance of actually transmitting it to the partner. So, I push patients to vaccinate both daughters and sons if you can. It's important. And you want to vaccinate them early. We recommend vaccination as early as 9. That's done in first world countries. Some people wait until high school, but yeah, get it. It's a
They've
gift.
had a lot of studies on.
Yeah, man. That's easy. You can Google them, have fun with it. But yeah, it's around and it works.
What are they called? What kind of vaccine?
It's a human papilloma virus vaccine. Similar technology as some of the COVID vaccines that are being given. It's mRNA vaccines.
That might scare people more.
I would say, the funny thing behind it is that the technology that they're using for vaccination has been around for a while. So I mean, it's safe.
Yeah.
It works. It works. And I would definitely say a lot of my patients have gotten the vaccine and I have multiple kids, so it doesn't affect fertility.
What about older people? Should they be getting this vaccine?
Excellent. So great question. We do push for patients who are out of the early vaccination window still to get it. So those patients may say, oh my God, I didn't get it in my teenage years. You find that in a lot of studies, you can vaccinate women in their 40s and even early 50s if they do have signs of the virus being present on a pap smear, or if they do genetic testing for HPV. So yeah, we can vaccinate women, yeah. If you're exposed to it, give it a vaccine.
Menopausal women too?
Wow, I'll be very clear about that. If you do have a patient who presents with an abnormal pap smear, beyond 54, I mean, you edge to say, I mean, the point of vaccination at this point may not be worth it, because you find that depending on what it is, if it's early, you can actually monitor or remove it and it tends not to come back. But you don't find a lot of patients at 54 presenting with I guess
that virus.
The virus, especially if they have a good history of doing pap smears. However, I would say that we're noticing a lot of patients who have never had pap smears done, and a great study was done by some of our local guys here, Professor Fletcher especially. They found that patients who presented with cervical cancer later on in life had never done a pap smear.
Really?
So it goes back to the bigger topic, which is that I like to tell a lot of my patients, get your pap smear done.
Get your pap
Give
smear.
it as a birthday
How
gift to
often
yourself.
would you recommend the pap smear?
Locally in Jamaica, we do it every year, recommend
Once
every
a
year. But we should speak about what's available. You can actually have your pap smear done every 3 years if you do the HPV DNA testing and realize that you don't have the high risk strange, which is the ones that can cause cervical cancer. If you don't have it coming up on that, you can actually get your pap smears done every 3 years. It's a little bit more costly. So actually doing a pap smear every year is actually cheaper than actually getting that done. So, you know, it depends on your financial background if you can afford it. But yeah, you can get it done every 3 years once you do that.
Okay. Question from one of our viewers, and she wants to find out what are the chances of having twins. How does that work?
Okay.
And especially because she's mid-30s and she has not got pregnant yet.
Okay.
I think she'll be interested in having 2 instead of 1.
Well, the first thing I'd like to say to any woman who is etching and saying, oh my God, I'm in my mid-30s and I just want 2 and to finish and I'm worried that I won't be able to, I'd reassure them and say, calm down. You can have them at separate times.
Yes.
And keep in mind that having twins also, before we get into answering the question, is 2. Your body will be carrying and sharing for 2. It's a lot more stress on the body. So it's good if you break it up. Now, to answer the question about having twins, if you have a very strong family history of having twins, there is a higher chance you can have twins.
Yeah.
But if you don't have a family history, it's not that it can happen, but it's very rare. And yes, your doctor can give you medications to make you ovulate, but that doesn't necessarily mean that you're going to end up with twins. So, you know, the other one that you find patients coming to is that if I do IVF, if I spend the money once, can they put in enough that they can have enough?
So they want 2 or 3 at once?
That practice has slowly been etched away. So I would say to women that you're going to find not many doctors going to be pushing for you to get, you know, twins being transferred at once. Because it does increase your obstetric complications, such as you can get high risk for blood pressure, sugar, complications with delivery, and also complications of possibly losing the pregnancies. So I would reassure a lot of women, you know, if you're blessed to have twins, amen. But don't worry if you don't get it, if you don't get all your babies at once. Break it up, speak to your doctor, you can go again. And I can tell you, I've delivered patients in their 40s who started their family at 40, 41, and completed their family at 40, 45, 46. So, I mean, I can reassure you, it can happen when you're ready.
Okay. Is it possible to not be compatible with your partner?
Wow. Very, very touchy topic. It can happen, but very rarely, where you do have patients or female patients who their body will just fight off their husband's sperm. I would say before anybody puts that into a bottle and say, this is what's happening, we're not compatible, I'd say you have to go to your doctor and do testing, and extensive testing before anybody can come up with that diagnosis. And there may be several reasons why a patient cannot conceive or get pregnant or have failed pregnancies before you can say, oh my God, is that we're not genetically compatible. Very rare thing though. Have I seen it before? I would say officially, no, I haven't seen it. I've seen patients who have tried several times, and we have been fortunate enough to deliver their lovely, lovely baby. And, you know, they have moved on and had successful pregnancies afterwards. But, you know, that diagnosis is so rare. And I wouldn't say it hasn't happened locally and doesn't happen to people. And I've seen even it go to the step further where a patient may switch partners and still unable to conceive. But a lot of times there may be other reasons. So it goes back to the humbleness of having the relationship with your doctor to find out what else is going on, why you can't conceive naturally. Yeah.
Okay. What advice do you give to the modern day woman who has delayed her family and she argues that she can't find anyone to have children with? What do you suggest?
All right, that's a bit personal, and we're etching away from just being doctor-patient now to going out to personal, and that's a conversation I reserve for patients who have a great bond with, and you know, they consider me as a confidant, and you know, I'm able to express myself freely. The first thing that I'd like to reassure a lot of women is that I do agree, things have changed, and you find that women may argue that the pickings for local men are not there. I may argue and say men are there, but advice I've given to some of my really good patients is to travel. Travel a little bit and see the world. I find that, you know, when my patients do take the little advice and encourage them to travel to different Caribbean countries or even Europe or even Canada, you know, they find that they go on a lot more dates, a lot more. Jamaican women are beautiful women. They're very self-driven, and it's a different taste to a lot of people in different countries, and you find that they're worshipped, if you want to argue, or even treasured a little bit more by the men who are looking for great suitors from these other countries. And I've seen a lot of my friends, personal friends, and also patients, you know, travel, and I've met some amazing people. Some of them never come back. They don't come back. So I like to tell them, you know, it's important to
broaden your horizons.
Yeah, broaden your horizons, and you know, see what else is out there. I think we lock ourselves into the pool locally and think that that's all we have. But I tell people all the time, it's nicer when you travel. So I encourage them, you know, take a lot of girls trips, travel, go around the world, and you will meet people. You'll be surprised. Some of these single men are looking out there to meet people on these vacations and these trips. And I have I've been a part of several pregnancies I've had to manage because I'm still considered a doctor, with them delivering all parts of the world, and they'll tell the doctor, so you have to call my doctor in Jamaica and ask him these things. And I'm humble to say that, you know, and I will reassure a lot of women, you know, travel a little bit, see the world before you consider, oh my God, I'm going to surrogacy, I'm going to go sperm donation. And I can say that conversation happens a bit with my patients, and I'm yet to see one come back and say I'm going to the sperm donation or surrogacy. Most of the time they're finding people. They're finding people. So I would like to tell you, women, you know, think of it as real estate. Put it in the hands of the diaspora, you know, those who want to invest in our local women, and you find that they go. But I reassure a lot of women that, more importantly, pray about it. Do have God in the mix, and it's important to do that and allow His will to be done. But don't put boundaries on the Lord, and don't put boundaries on expectations on life, and dance. Really and truly. Get up and dance, girl. You just dance.
Once you get that chance.
Oh gosh, you just dance.
You dance.
Yeah.
Okay. Thank you so much, Dr. Adrian.
Well, thank you for including me, Auntie Faye. So a lot of people don't know, Auntie Faye has seen me grow from here to where I am now. Yes. And I'm humbled that I am doing an interview for her YouTube channel. I'd like to tell her thanks for including me, and I'm very proud of you. She is a wonderful mother, a wonderful friend to my mother, and also treats us my family, the boys in our family, as her own sons.
That's right.
And she does look after us, does take care of us. And I want to say, more importantly, thanks for being a stand-up mom, a stand-up woman, and more importantly, a stand-up businesswoman.
Oh,
and I wish you the best.
Thank
Thanks for
you.
including me. And I do humbly say, include me in other future endeavors.
I will.
And it was fun. It was fun. It was fun. It was
Thank
fun.
you
Thank you
so
for
much.
having me.
It was so wonderful to have you and to be sitting here at your, what was your mother's desk?
Well, it still is.
Still is her desk.
Still is.
But that to know that you're sharing this desk with her.
Yeah.
That's so nice.
Yeah, it's humbling. It's humbling.
Thanks so much.
Blessings.